You're in chart output and the input.
No, this is the forms for the patients that have the information about the patient.
Okay.
Okay, Dr. Jones is always mumbling about which dressing materials he wants and then yells at me if I don't have the right ones at the bedside. I can't understand you because you're mumbling. If you would speak more clearly, I could make sure to have the dressing materials you want at the bedside.
Yeah.
Okay? I can't understand you. If you speak clearly and slowly, I can make a better effort. You're so inconsiderate. How dare you call me incompetent and criticize my ancestors in front of my colleagues? I was so embarrassed when you criticized me in front of my colleagues. I would appreciate it if you have something to say that you would say it to me in private if it is a negative comment. I would expect to do the same for you.
Yeah.
She never does her share of the workload. I feel like I'm having to do some of your work in addition to mine. That can't be the best thing for the patient. If you would work more effectively, if you would like, I can give you some tips on how to use your time more effectively. Something like that. Okay. You're so selfish. You don't care about me one bit. All you do is spend time with your friends. I sure would appreciate it if you would spend more time with me because I love spending time with you.
Of course.
Right? You ought to get more exercise. You guys did a pretty good job with that one, right? I feel so much better when I exercise. I'm worried about you because you know that your grandma had a stroke, and I think you would feel better too if you would exercise. I'm wondering if you'd like to join me. You could walk every day.
Yes.
Most people would complain about the number of times you are late.
I'm annoyed.
I've noted that for the last week, you have been late between 5 and 15 minutes every day. This is unacceptable behavior at work here. I'm wondering if there's something that we can do to help you to organize your time better in the morning so that you can get here on time. This is a professional responsibility. It is an expectation that I have of you, that you will be here on time. Okay. You never admit when you're wrong. That's number 8. Nobody took that one. You never admit when you are wrong. I think it's fair to say that nobody's right all the time. So it might be worth looking at to discuss when I think that your opinion is incorrect. Okay. Those nurses on the internal medicine ward don't know what they're talking about. How would you deal with that one? Those nurses are so stupid. How do you change that into an I statement? I feel like you guys need to have more information about the patients when you're transferring them to us. It would make me more comfortable if you would have a more complete form when you transfer them, so that I could make sure that the care is continued appropriately. Right?
Yes.
They're no more stupid than anybody else. It's just, maybe there's a better process. Okay.
Yeah.
All right. What did you learn from this? Not easy, right?
Yes, not easy.
Very easy?
Not easy.
Not easy. Number 9. Oh, I didn't do number 9. The whole team is fed up with you calling off sick and not coming to work.
Barariye barahaga cyane. The whole team is fed up with you calling off sick. Donc bararambi bakurambi is fed up with you calling off sick and not coming to work. Abantu bahaza uburyo uri kuvuga ko urwaye kandi ntuze gukora.
and that you can't get the dedication here that way. Right? Something like that. All right, the more you can practice I statements, the more assertive you will be in your conversation. Okay?
Yes.
The more assertive you will be. Remember the previous things about assertiveness? Yeah, it will help you to represent yourself without being without being rude to other people, because you're saying what you feel. Nobody can complain about what you feel. You're the one that owns what you feel and how you act. Make sense?
Yes.
Okay, guys, we got to make it a quick break.
Yeah.
Go ahead and move your chairs back into position. Take a 5-minute break and come on back in. We've lost some time this morning, so we have some things to catch up on.
Yeah. Thank you. Nyine ni ukuvuga ko wowe ujya gushaka kugira ngo bivuge mu magambo yawe wishyiraho wiyerekezaho no kuvuge nk'aho ari wowe uri kubivuga nk'aho donc ari wowe uri kubitangamo nyine ngo wowe ngo uragira ngo ni nko kuvuga ngo urambangamira cyangwa se urandakaza iyo utakoze ibintu byose neza. I feel made when you leave a pile of chat in the black room because it can make them lost, and I would like you to change that kind of behavior. Ngo birambangamira iyo ukoze ibi ngibi kuko bishobora gutuma hari ikibazo kivuka, ahubwo numva bagakwiye kujya ubigenza gutya na gutya. Mbese ni nka example yatanze nawe wakwingira ibyawe nuko namwe uraho musaza wakwiyaye uraho musaza mwiza musaza Sibo ese wagezemo Steve akwise Steve Amani akwise Steven nawe ushaka ko ari yaeri Steven Steve asani wena Steve ne yaeri be hata Steve nuye yaeri yihe itango cye mugabo arambura nyine ni Steve ni yaeri bitwa Steve nukuri bata Steve ishaka ari nka Favirenza hamwe na Nuza combination ramakanyije Favirenza naki na Nuza na Favirenze na maere bifite ntabwo ngira ndayikwereka umva shaka amano collective y'amaere dushaka izina rimwe kwa Steve tugende njye kwikwereka Steve muri chambre